So the treatment, see, there is something called as supplemental oxygen which you have to give. It is always warranted because there is a leftward shift of the oxygen hemoglobin dissociation curve. So this is the hemoglobin oxygen dissociation curve. So there is a left and a right and a normal. So if there is a left tilt dissociation, which means that the saturation is low, so you have to give oxygen for this, right? Adequate pre-oxygenation will prevent ventricular arrhythmias. The next one is you have to insert gastric tube because there will be a decreased bubble motility. Indwelling catheters can be used. It can use for temperature monitoring as well, and also for cold induced diuresis, right? Normal saline is always preferable to lactated ringer solution because in liver, in hypothermia, it will not metabolize the lactate. So this is also a potential question, right? You can also insert CVC in the cold right atrium, but it should be avoided since this procedure, similar to transvenous patients, can precipitate arrhythmias. Already hypothermia patients will be having more precipitation for and more risk for arrhythmias. And arterial blood gas monitoring should not be corrected for temperatures. An uncorrected pH of 7.4 and PCO2 of 40 will be reflecting appropriate ventilations and acid base at any core temperature. This line will directly be asked in this Neet SS. Mark it. Okay. Whenever the PCO2 decreases by 10, it doubles the pH by 0.8. Consider EtCO2 monitoring to prevent hyperventilation. When you do hyperventilation, there is CO2 washout, right? There is CO2 washout. Once there is a CO2 washout, then what is going to happen? Decrease in the PCO2. Decrease in PCO2 will cause increase in pH because of loss of H plus ions. Okay. Next, the severe anemia can also be done. However, hematocrit increases by 2% for 1 degree drop in temperatures. This also you have to be knowing. Hypokalemia is common in chronic hypothermia. Hyperkalemia also occurs. So these both can occur. Remember this, right? Then coagulopathies are also common, as I told, because of the inhibition of the enzymatic reactions required for the activation of intrinsic, not extrinsic. Remember this. It's the intrinsic cascade. There is a thromboxane B2 production by the platelets, and the platelet function is also impaired. So these will cause coagulation. In addition to that, there will be organ failure, like hepatic organ failure, which can also cause this. So rewarming. 2 questions asked in 2025 Neet SS. Okay. Passive external warming, covering and insulating the patient. That's all. Right? It is only covering. Rate of rewarming is usually 2 degrees Celsius, that is 4 Fahrenheit per hour. Patient should have sufficient glycogen to support the endogenous thermogenesis. This is a prerequisite, right? There can be precipitation of after drop. When you directly give active temperature from outside, it will cause vasodilatation and sudden drop in core body temperature, right? But it can then cause vasoconstriction and it can cause increased heat. So you have to avoid direct application of it to the extremities. So you can give it to the body but never to the extremities because of the same mechanism that I have mentioned here. Okay, right. Next, I would like to tell about the active rewarming. Active rewarming is also very important when there is less than 32, that is a moderate hypothermia. When there is organ involvement also, CVS, CNS, adrenal insufficiency, you will have to do active external rewarming. How do you do that? Forced air heating blankets. Direct can be asked. External heat exchange pads, radiant heat sources, hot packs, very important. Don't give electric blankets because it can cause burns, right? You have to always do a airway rewarming, can also be done with mask or ET tube, giving a heated humidified oxygen. But it is not much useful. You can give crystalloids. It can be heated how much? To 40 to 42 degrees Celsius can also be given. But it is significant only if you give in large amounts, not in small amounts. This is also what you have to know. And the next one is that you can irrigate the gastrointestinal and the bladder. See, I have told here, this is where experience matters, right? There is insertion of NG tube. Why? For motility and bladder also. But see, whenever you study Harrison, this is how you have to integrate it, and that is where my role comes here. You have to give a irrigated hot water, that is a gastrointestinal tract and bladder. Okay, that also you can give, and it always has to be reserved. These are reserved techniques. Also, extracorporeal life support, thoracic lavage with hot water, again thoracostomy tubes, right? Peritoneal lavage with high hot water dialysate, and you can also go for endovascular temperature catheters. Okay, and there is this very important score which you can consider coming this year is a HOPE score, not hopeless. It is a hypothermia outcome prediction after extracorporeal life support. Okay, it's a HOPE score, HOPE score, right? The treatment, whatever we have told, but one thing I want to tell you is that here medications are usually withheld below 30 degrees Celsius. Whatever the patient medications are taking, don't give, because it will never act. Circulation is gone. GIT circulation is also gone, and blood is having coagulopathy also. Don't give insulin, don't give digoxin, nothing, don't give any toxic drugs. MAP is 60, remember it's not 65. Crystalloids or colloid infusion, hypotension, if it's not responding, always the inotropes you are giving is here, remember it is dopamine, right? Remember it is dopamine. And if you give nitroglycerin, there will be some improvement in, there is vasoconstriction because of hypothermia to prevent the heat loss, right? Also atrial arrhythmias are also very common, right? And then for VT or ventricular arrhythmias, that is also very common here. There is no need for any antiarrhythmic treatment if you see arrhythmias in cases of hypothermia, right? Don't do anything, just you have to do CPR and you have to resuscitate the patient, right? The administration of paraenteral levothyroxine to euthyroid patients with hypothermia is hazardous. This can also be asked this time, right? Okay, and the options for extra corporeal life support, this is what is ECLS. This is a dialysate, right? External dialysate and dialysate ECMO. All these things you use for rewarming. The only thing is you give a solution which is heated. Okay, so there are something called as now the peripheral cold injuries, which I want to tell. You should not give antibiotics unless infection is suspected. Never give antibiotics. If there is suspected, only then you have to give antibiotics. So peripheral cold injuries, frostbite. See, can you see it occurs in this? One question was asked in frostbite. They usually occur below this 0 or 32. Ice crystal formations cause, which will cause the vascular thrombosis and ischemia and edema and pressure source and mummification. But this mummification will take over weeks to months. This is what you have to know. The thing is, the grading is not that important for this, which cannot be asked. But the problem is there is hemorrhagic vesicles which are there. They asked last time, what do you do for hemorrhagic vesicles? See, you should never incise or do anything. You should just apply lotions or ointments, topical silver sulfide iazine, etc. Never incise. This was asked, whether do you incision or not, right? Because it can damage and it can result in amputations, right? Don't do anything. There is trench foot, you know this, and also perineum, there is chill veins, all these you know. So you have to immerse them in cold circulating water. The temperature is also given here, 37 to 40 degrees Celsius, not by hot air, it is by hot water. So this one is a potential question this time. Okay, parenteral narcotics also is considered for deep phosphate because of intense pain. You do a thawing. You should never do a premature thawing, remember. And also you should never terminate the thawing because it can cause reperfusion injury and can increase the tissue compartment pressures. You can also consider antithrombotic and vasodilating treatment regimens also. A direct question was asked in Neet SS 2025. Where there is no conclusive evidence that sympathectomy, steroids, CCBs have been given. Though prostacyclins within 48 hours, its ioprost is also an option, right? You can also intravenous or intraarterial thrombolytic therapy can also be given in patients with deep frostbite. Remember that last time a superficial frostbite was asked. This is for deep, even this is for deep, right? Antithrombotic and vasodilating treatment also can also be given. Only after rewarming with frozen water you have to consider, right? So this thrombolytic therapy which you are giving can be used, apparent is one which is recommended, right? Intraarterial thrombolysis may reduce the need for digital and more proximal amputations within 24 hours. This is a potential 2026 question, exam question as well, right? The next one is this last treatment of frostbite. See, I will tell, leave hemorrhagic vesicles, right? This is very important. Don't, if clear vesicles are there, you have to aspirate and you have to debride it if it is broken. Never aspirate, never debride. Hemorrhagic, only clear you have to do. You have to dry this spot and you have to protect it. Okay, you have to consider giving ibuprofen because you are thawing it, so you are heating it, so there can be pain. You have to consider TT, elevate the part, hydrotherapy when at 37 degrees Celsius. And again, this dextran may interfere with coagulation. I would suggest don't give it. Okay, parenteral narcotics if the pain is refractory, and you have to encourage the patient to move the part. This is also an MCQ. This entire table is a potential MCQ. Okay, first thing you have to do is you have to remove the patient from the environment, and only then you have to start the thawing, and you have to never prematurely stop the thawing. You have to consider parenteral analgesia, also ibuprofen. Don't remember the doses, not required. Okay, you have to immerse this part. It should have water plus antiseptic, right, for 10 to 45 minutes. So thank you guys. This is the fourth part 2 of cold injuries. Subscribe so that I will finish off the Harrison series if I get adequate participation and support.